তাহলে ওই যেটা শিবাশিসকে ফোন করলাম ওইটা বাকি।
So now there's another method of data collection, like we did the IDI and we did the KII discussed today. So there's another way of data collection, that is the focus group discussion. So here you talk with a group of people, and there many times the choice of the data collection method depends on your research question. So if you have a question like why do people opt for treatment in any hospital, like any preference or something like health seeking behavior, where everybody can relate to this particular research question, even in case of this doctor patient communication, you can conduct FGD, because it is everyone will feel relatable to this research question, and there's no issue like it doesn't seem like there is some stigma associated with it, so the people can talk freely on this topic. So again, one more research question, like why do people choose from different, like there's a surgical option and there is a medicine option. So why do people opt for medicine more than the surgical option? If this is your research question, then again you can conduct a FGD. Or why do people get impatient in hospital? They can't wait. Many time if you are in a hospital, one or the other person who knows you, he will come and he will want everything to be done in a fast forward mode. Like they don't want to wait. Even if they are standing outside the doctor's room, they'll call us and say, please call the doctor to call us inside or something like that. So they get impatient in hospital. Whereas they might spend hours in social media or on television in front of anything. But when they come to the government hospital, everyone wants their work to get in a fast forward mode. Or how do first year students get adjusted to hostel life? Something related to students. So if such research questions are there are others, I'm just skipping them, then focus group discussion can be a method of choice for data collection. Especially if you want to know the people preferences or their collective thought process as a group, because these things affects a group. If the topic of interest is like individual means, like if you want to know stigma related to HIV, or if you want to know like domestic violence, or like we were discussing the narratives and phenomena, what that particular person what happened to that particular, or what sufferings he through which he went. So in that case you can go for a IDI. But the topic which affects an overall group, or it shows the people preferences, then you can opt for a focus group discussion. So focus group discussion, it's about a group opinion. Like in case of alcohol also, we did not go for a IDI. Why? Because in IDI, one thing is there, that you will gain the insight of only one person. Whereas wherever it affects a large mass, then FGD is a good option. So the main purpose of a FGD is to explore how people think cohesively as a group on any research question. So like generally we conduct a lot of FGDs in medical education regarding the student perception, or maybe the curriculum development, what teaching methods they want, or assessment. Like do they want Viva these days? Like people are against many days, like we are seriously thinking Viva Voce as a pattern of examination, whether it should be there or not. So if something of this where it affects a large group, whether it is a student or a community or any special group, then you can conduct a FGD. So now can you see these two pictures? So first focus on this picture towards the left side. So what is this method of data collection? Yes? You can type in the chat box. IDI, KII, IDI, KII, KII. So no, but all these people are sitting together. Unidirectional, yes. This person, like investigator, is talking to everyone. Okay. And what about this, the second one? This method of data collection? FGD 1-to-1, and Dr. Abhijit is writing, okay. Dr. Tapoprata is writing FGD, group discussion, interactive with each other. Yes. So Priyanka, you can say like they are talking to each other sideways also and across also. So generally, if you see this first one, which was towards the left side, which is towards the left side, this is known as the group interview. So this is a group interview where everyone is sitting together, and in one of the like we did one qualitative study on perception of stigma related to HIV in general practitioners, like in private practitioners and government hospitals also. So there, when we went to a private practitioner, they were having lunch, like 3-4 people together. So we took the appointment from one person, but then everybody else started sharing their views, but only with me, like with the interviewer, not with among themselves. So that time we wrote in the methodology that it was initially it was planned to be like an IDI, but then we converted it to be a group interview because everybody started talking, and then we have written like practitioner 1, 2, 3, something like that. So that was initially not planned as FGD, and we tried also like making them interactive among themselves, but all of them were talking to the interviewer. So that's why many times it happens like you go uh, to one person, and if like the relatives are also sitting and they also start sharing there. So you have got two options. Either you can ask them to wait and then you can talk to them separately, or if they are in a flow and you don't want to interrupt their flow, then you can like take their views also, and then you can make a transcript accordingly. So why to do FGD? So because in qualitative data, I said that if you interrupt something, then it will be difficult for you to take those, viewpoint again, because then the patient will feel that, you did not talk to him, or the relatives will feel that their viewpoint does not matter for you. So you have to see, like, you are the best judge in your case. But what generally we do, like, I don't ask someone to wait outside and let me talk to one person and then I'll talk to you. Why? Because then he might leave or he will not feel like sharing, because that time he was like vibrant and thoughts were coming to his or her mind. So what I prefer that it should go in a flow. Like if somebody is accompanying and they are also sharing or adding something, then there's no harm. Later you can decide whether you will include that in your analysis or not. That you can decide later, but at least you will have a rich interview. I mean, rich transcript. So why to do FGD? So as a generally we say FGD when you want the group perception, then you should about something, then you should do the FGD. And generally, how much FGD? How many FGD? So it is said that since FGD involves like 6 to 8 people, then even if you do 4 FGD on any topic, that is sufficient. So yes, it is less resource intensive as compared to IDI. And it can have like it can act as a supplementary source of data. Many times you will see that people, they go for 4 to 5 IDIs and 1 or 2 or 3 FGDs, because then they have got like we did not do that data triangulation. Data triangulation means you get the data from multiple sources using multiple methods. So like in qualitative data also, you know that there is an observation, there are some pictures, and there is a IDI, and there is a FGDs, there is a KII. So if you want to triangulate the participant, then you can use IDI, FGD, and KII, all the three. So yes, Dr. Abhijit is writing multiple responses at the same time. Should it have heterogeneous participation? Yes, it should have. In case of our IDI, also remember we talked about the saturation and homogeneity and heterogeneity. So if there is a homogeneous data, then you will get saturation very easily. Not data means homogeneous participant. So that's why we say that it's a purposive sampling, and you have a choice to select like people who belong to a diverse group. Like in case of alcohol, we try to include like more than one, probably the socioeconomic status, and we tried including more than one occupation also. So you can select depending on socio-demographic characteristics, because that's the only characteristics by which you can select participant. And then again, their readiness to come to a particular neutral place, their willingness is also important. So you can also have this FGD as a supplementary source of data, like Dr. Abhijit was also sharing, and we have also talked about like exploratory sequential, when you to develop a survey questionnaire or to explanatory sequential to validate the finding of a quantitative study, mixed method. So FGD can be as a good supplementary source of data, or it can be a part of multi-method qualitative study. Like I said, as a part of triangulation, when you have the interview, observation, and FGD, all three as a method of data collection. So what is not a focus group discussion? Like I said, moderator talking to one person only. It's not a focus group discussion. Generally in FGD, I'll show one video where you will see you should have multiple. So your role is to have a like a facilitator. So you should encourage everyone and to take their view also, because there can be a time when one person is dominating the discussion. Like it depends. If one person is very vocal and very expressive, he will be talking most of the time, and then others will keep mum. They will say that, okay, he's talking, let him talk, and we are not going to talk. But you as a facilitator should have an eyes on those people who are not talking, because their perception and their voices are equally important. Maybe they may come up with something very unique, which the person who is speaking more is not giving you. So that's important. You should not let 1 or 2% dominated the whole FGD. You should take care that everyone should get a chance, and you should encourage him or her to speak on the FGD. So role of facilitator is very important in case of FGD. And he should not be speaking, because I think we saw 1 or 2 FGD in the field with our faculty when we were resident, when we were doing our residency and our PG-ship. So they were calling that as a FGD. But when we read and we have started conducting the FGD, then we have realized that that was where only the person, the facilitator was talking. He was only talking, and the other people, they were not talking at all. So that was not a FGD at all. So there should be group interaction. It's best that everyone should interact with each other. Then it will be like pros and cons. Like someone was saying in favor of alcohol, then other female, they started saying, no, we don't want alcohol because it leads to domestic violence. And it's good that now my husband comes home on time. He doesn't waste time. But again, when we did this, again, the site and locality is very important, because when we did this study on the bordering districts of Bihar, like the districts which were bordering to Jharkhand and Nepal, because Bihar is like has this borders with Nepal. So there the women were saying that the alcohol ban is very bad. Why? Because initially the men, they used to come home early, but now they go to Nepal. They stay for the whole night there in Nepal, and then again they in the morning they come back to the work, but they don't come home now. So maybe, varied experience and perception of people, depending on locality also. So that's why we included the bordering districts also, because things were quite different in the bordering districts. So FGD is quite effective again, and the role is more on the facilitator. So again, we did this difference between the focus group and group interview, the focus group discussion and group interview. So the researcher adopts the peripheral role as a moderator and facilitator. And in group interview, the researcher adopts an investigative role. Again, we have said that there is a sociogram. So everyone is talking to each and everyone. So that interrelational or interpersonal dynamics, or what we call is as a group dynamics. So group dynamics is very important. In group interview also, the researcher basically controls the group dynamics. Again, participant selection, like Dr. Abhijit and other people were saying, it is purposive. So you should have people from heterogeneous background, so that you should have a rich insight of people on a particular research question. And again, your role as a facilitator is to keep members on track. That is there in the IDI also. Whenever they digress, you have to keep them back. And especially with very literate people like doctors and people who are on like at a key informant position, it will not happen. But this happens quite a time when you are interviewing a relative of a patient, or when you are interviewing a patient. And you should encourage all the participants to speak. Again, time is important. And of course, like you have seen, regarding the questions, there are many questions which may not be relevant, which you have framed initially, and interview can go to any direction depending on the kind of responses you get from the participants. So there should be a prior plan for conducting the FGD, like identification of the participant, especially in a community setting. I told that setting an area, that is very important. Arrangement and logistic. And you should also be sitting on the same level. Like in villages, we sat on the floor, on the soil, on grass, where it was. And that time you cannot say that it is not clean, or I can't sit here. So you have to behave as if you are one among themselves. Then only like them, then only you will have a good, because rapport building is very important in case of FGD. That is there in case of IDI also, but in IDI you have to see only one person, whereas in FGD you have to see so many persons. So your attention should also be very much you should be engaged with the participants all the time. And you should always recruit more participants. Why? Like we say that you should have at least 8 to 10, but send invite to at least 12 to 14 people. Why? That when there might be a case that you have gone to a particular village on that day and 3, 4 people, they don't turn up. Like you can see in this workshop, generally like 50 to 60 people participate, but ultimately it's 50% who is going to attend it regularly for 5 days. So enrollment is always more, but actual turning up of the participants is less. So that's why you should recruit more participants, so that at least you should have 6 to 8 participants on the day of the conduction of the focus group discussion. Arrangement of logistics, like we said, it is same as IDI. There also in the IDI you have a person who is going to help you. Here you will need someone from the locality also. Generally, we used to take help from Asha and Anganwadi worker, because we chose their area, like their houses or their premises as one of the setting. And or you can take any prominent member, a school teacher from the locality who is going to help you, calling the people and convincing them, because you are an outsider there. And if you go and start conducting FGD in case of a community setting, in case of a hospital setting where you are working, it is easy because things are in your control. So when we conducted FGD here in the medical education department, that was easy, because students are our own, and it's our own space and place and logistics and infrastructure. But when you have to go to a village to conduct an FGD, definitely you need support. And all approvals we have initially talked. So in case of a village, if you have to conduct FGD, always go and talk to the Sarpanch or Mukhia. Explain their purpose and show them the written approval from the state that you have got this approval to conduct, because you have to take these approvals. In case of a larger studies, if it is a small study, your thesis, then it is not needed, but still you should go and talk to the Mukhia, because he's the overall head of the village. And then with the help of Asha and ANM or any other local workers which you feel they have got an influence over the population, you can take help from them. And then interview guide you have already. And in case of FGD, generally we always give snacks. We arrange some snacks, like maybe whatever is available locally. In case of IDI, even if you don't give something, that is okay. Why okay? Because it is only one person. But IDI, generally FGD lasts longer than the IDI. Generally, it takes, like in case of alcohol, there were many FGD which went for 1 hour or 1 hour, 10 minutes. You can't stop them in between. So in that case, you should arrange some snacks, some incentive, yes, to participation. I don't know, it depends on the budget which you get. Incentive, generally, we don't give in the form of money, because then it may have some selection bias. Generally, we give it in the form of snacks or something like some gift hampers, or if it is related to kids, some gift hampers we can give. Yeah, you have written that, no, not necessarily. Yeah, true. Yeah, sorry, I could not see your message completely, Dr. Abhijit. You are right. So yes, that's and in case of like few projects, we gave them cash also. But cash, why? Because we asked them to travel to AIMS. When we did one study with HIV and visceral leishmaniasis, we have asked the patients to travel to AIMS because they were taking treatment from some other place. So we have assisted them, but again, like loss, because of their loss of wages, we have given them cash incentive also, but that was the arrangement from the funding side, like funders who like they, it was in under that budget section, so they gave it. But for small project and thesis and everyday routine research, you can't give money, so that's better that you can give some like some incentive. True. So again, recording, you can do recording, you have to do like audio recording, you take the consent also, you take the notes. And video recording, yes, it's difficult also, difficult logistically also to do. And many times people, they don't want at all, especially in Bihar, for video recording, they will not give you consent. For audio also, they might refuse, but audio still they will say okay. But again, it's an alternative. So we should observe four most important thing. Again, we since here you have to introduce the overall topic to the people, on which topic you have come to discuss on, and participant information sheet you hand it over to them. But many of them will not be literate, what we have seen as an experience, and they are not, the moment they see something written, a big paragraph, they don't want to study, they don't want to read. They say, you please tell us about what you have come for. So do you explain your purpose, your background of the topic, for what, and what kind of ground rules, like ground rules, why it is important? Because if you will see that if one person is talking, the other person starts talking in between. So you have to set some ground rules regarding the phone. And if let the other person finish their talk, then only you should start. The way we teach to our students. So similarly, you have to tell some ground rules there also. Many times what we have seen that women, they usually come with their children. So like small kids are there. So if you have called them as a participant, they will come with their children. So don't expect them to be like saying that, no, don't come with the children. So they will be sitting, and the small child may be sitting in the lap or by their side. So you have to like bear with them, and you have to take those interruptions in between. So watch this video of our FGD. Let me share you the sound.
The moderator is about to be.
See this and keep on like sending your messages on the chat box, so that I'll see what are good points, or is it a good FGD or a bad FGD, the way you did in the IDI.
Begin the actual focus group. This introduction is short and snappy and covers 4 points: a welcome and introduction to the topic, some background on the topic, ground rules for the focus group, and the opening question.
Well, good afternoon and welcome to our session. My name is Dick Kruger, and I'm with the Happy Traveler Research Agency. And we're pleased you could all join us today for our focus group. We've invited you to join our discussion on airline travel. Today, we're going to be talking about experiences that you've had in traveling by airplane. Experiences that within the last few years. We're going to be talking about things that have worked well for you, things you've enjoyed, as well as things that haven't gone so well. This study is being done at the request of the airline industry. As you may know, people have had a variety of experiences, and airline industries regularly are trying to improve the quality of their service. And so at the end of our study, we're going to be sharing information back with them. Also, if you're interested, we'll have a copy of the report available to you as well. Let us know if that's something that you're interested in. You were selected because you were among a group of people who have traveled fairly often over the past few years, and we're glad you're here for our group. As I indicated, my name is Dick Kruger. I'm with the Happy Traveler Research Agency, and my colleague is Mary Ann Casey, and she'll be taking notes and helping record the conversation. We're going to be tape recording today. We have a microphone in the middle of the room, and then we tape record so we don't miss any of the comments. Oftentimes people say things so well, we're not able to write them down quickly enough, and the tape recorder helps us capture those. There's just a couple ground rules that might help us. If you have a cell phone, we'd appreciate if you turn it off or turn it on the quiet mode. If you do need to respond to it, please step out, but then come back in as soon as possible. We have more refreshments and some chocolate over there at the side table, so help yourself to that whenever you feel a need for those things. There are no wrong answers today in our conversation. Many people have different experiences with airline travel, and so feel free to comment even if your thoughts and ideas or experiences are different from what others have to say. My job is to guide the conversation and to keep us on time and be sure that we finish at the end of our allotted 2 hours today. And so along the way, I may interrupt, I may push us along a little bit faster. That's so that we can finish our conversation on time. Well, let's take a moment. Also, by the way, we're going to be on a first name basis. We have name tents with our first names on. Let's take a moment and go around the table and find out who you are, and would you tell us your name, and then also tell us where you've traveled to by airplane in the last year, and would you name some of the cities that you've traveled to, and would you start?
I'm Jim Brown, and the last year I've traveled.
At the beginning of a focus group, most comments are directed directly to the moderator. But as the focus group continues, the moderator will try to get people to look across the table and speak to the other participants. This is a good sign and something to be desired in your focus groups. One of the effective techniques of moderating is to use a short pause, usually about 5 seconds. This allows participants a chance to reflect and think and a chance to express their thoughts.
Okay, well, let's get started with the questions in our focus group. The first one, and we're not going to go around the table, and anyone can answer this who chooses. Tell me this. What do you like about airline travel?
Oh, I can start, Dave. I like that it gets me between two places relatively quickly.
When moderating a focus group, you'll find that some people talk too much and ramble on about a topic, and you'll need to have a strategy for how to deal with this. Here's an example of what you do when a person talks too much and how the moderator redirects the question to another participant.
All right, well, let's talk about inconveniences. In your experiences with airline travel, you may have encountered an inconvenience. May have been in the last year or a little bit before. Would you tell me about an inconvenience you've had?
Well, let me tell you, it's always around baggage, and it seems to me that there's always something that happens with my baggage when I travel. I was coming back from Bangkok. I was meant to get my baggage in LA to take it through immigration, and when I got there, couldn't find it anywhere. It just wasn't there, and I stood there and stood there and stood there, and I went behind the counter to the counter, and they said, well, you know, it's just not there, and it'll turn up eventually, and maybe it'll turn up in Minneapolis. But it's just been one long string of things after another. I mean, the baggage is always too large to fit in the overhead bin, but it's even worse when you're traveling by train, because when you're traveling by train, you have to get the baggage up from the platform, and then you have to haul it into the coach, and then you're pulling it all the way down the coach in order to get to your seat on the train, and there's never anyone there to help.
Yeah, that can be a problem. Let's hear from some others in the group. Francis, how about you? Have you had an experience with an inconvenience?
Well, I haven't had a problem with luggage because I always...
Sometimes participants do not talk very much in a focus group. One of the strategies that moderators can use is to look at those individuals and at times call on them and invite their comments. Here's an example of how it works.
Sherry, we haven't heard from you on this. What are the things that you don't like about airline travel?
Well, mostly two things, luggage and children.
Tell me about each of those. Tell me about luggage and tell me about children.
Well, with luggage, you never know if they're going to accept your carry-on or not. In some airlines, even in the same airline, sometimes the carry-on fits. They say it will fit in the overhead, and other times they take it away from me, and then I have to check it. So even though I think it's standard size, sometimes it doesn't.
One of the things that happens in a focus group is there are key moments when people start to own the group or feel like they are a group and in a discussion. Here's an example. When these things occur, moderators often encourage these and allow people to talk across the table to each other.
All right.
You know, I want to say something else about luggage, and it relates to when planes are late. You never know if your bags will make it. And sometimes it's not your fault. You've checked it. You've done what you're supposed to do. And then they mess it up. And then you get there. You don't have, so I carry now a lot of things in my carry-on because I just have to assume it won't make it.
I never check anything. I always carry on. Never check it.
Because you just can't.
I never trust it.
Yes, so I think there's one question is Dr. Tapobrata, is probing allowed? So yes, you can do the probing. There's no issue if you are. Just a sec, let me check. The setting button. Okay, so yes, and I think the moderator is telling every step and each and every trick in between to tell you what a good FGD should be. So few tricks he has communicated very well, like how you can find a pause and then you can go to some other person asking directly from a person. So these were the
moderator
good tips.
is about.
So now coming to the what do's and don'ts moderator should do. So do's, if you see the open a session with fun, if you can have some funny things in the beginning or in between also, that will help in the bonding of the participants. And again, regarding balancing the participation, the person who is not speaking or speaking less, you can encourage them to speak more. And again, like you can see what are the don'ts. So you should not like we have seen the questions should be, it should come, you should not be reading the questions from the paper and then asking. You should not be judgmental and you should not make assumptions. And again, like I said, like you should not allow 1 or 2% to dominate the discussion. You should not permit side discussion, especially it should be across the table. Why? Because if the two side people are talking to each other, then again there is one issue that it will not come in the recorder also. And again, if two people are talking with each other, then the other people they will not be able to hear. So those side discussions generally they are not permitted. And again, you can challenge. If you are seeing that everybody is saying the same thing, you can act like you are of the opposite opinion, and then see few other people who are not speaking what is their opinion. So again, I think these are all same thing. There are some challenges like lack of representativeness. I said like finding participants and like they're coming on the actual day. It might be little challenging for you people. And again, there can be like misuse means some misjudgment, and misuse means like other people will also start in the village. What we have faced, like they will come and they will stand on the outer line and there will be one more line outside that. So 6 people and 1 moderator. Apart from that, there will be 20-25 more people who will be standing, making a circle. And then it is very difficult. But again, you have to be smart enough to conduct FGD interview. FGD in such scenario. So we faced this scenario during the alcohol survey that, ultimately we had to facilitate a lot, not to allow others. Other means there were a lot of people, because in village, everybody, like, they are at home, and if they see someone, like people are coming from outstation to to conduct FGD, it's a fun activity for them. So everyone will like keep on standing. So you cannot ask them, because it's a village. So you cannot ask them to go away from that place. You have to bear with them, do the moderation. And even for, like I said, like for snacks and other thing also, you have to arrange some extra packets, because when you are giving it to the participants, other might ask for it. So you should be prepared like for a large scale FGD. I think these are, it's not needed. Group and interview we talk. So these were few of important things regarding FGD. Again, FGD, generally we talk like when should FGD should not be done. So if you are doing something on a sensitive issue, like domestic violence, intimate partner violence, HIV, like we did on HIV, the stigma. So if something is related to issue which is social stigma, or people don't want to be get identified, the drug abuse. So in that case, you should not have a FGD, because people then they will not come and they will not be very open. So IDI is the choice of data collection method when you are doing something on a very sensitive issue. So Dr. Dhanya is writing, should there be, Dr. Shamshad, can you show me that chat? Should there be a note taking if we are recording the audio or video? Again, I said, you will see the way we have make the transcript. Ideally, we take 3 people in the team. One is the person who conducts the interview. Second is the helper, means who helps in writing down the other points, taking notes, and also to guide the main interviewer if he or she misses any question or any other question. So yes, 2 people. And then there's third person who manages the site. Site means not allowing other people to come and like manage that it should be less of noise. So again, I said that if in recording, if lot of noise comes, then it will be difficult for you to get a transcription. Even with those software, if you don't have a good audio quality, you will not get a good transcription. So there will be a lot of mistakes which it makes, and you will also have a difficulty in hearing and listening to it and then making transcript. So Dhanya, is it okay? Note taking is that's important. So anything else do you want to ask in the FGD? Okay. If not, so I think let me show you one transcript of FGD. It is in day 2. This. Okay. I'm going into that day 3 folder. So like this is one of the, you can see, these are the participants like ANM, ASHA, patients and relatives. If they are the participant, so like moderator has started with a question, and then ANM is answering, then ASHA 1 is answering, patient 1 is interjecting, then ASHA 2 is saying, patient 2 nodding, something of this sort. You can see. But here, like in that video, you can see that they were calling everyone by name. It is difficult here also, and also we don't want to have a direct identifier. So generally we don't write names, and it's only the designation or maybe the patient wife or caregiver or something like that. The transcription and the coding. It will be done in the similar way as you will see in case of a IDI. So there's no difference except it will be like R1, R2, R3, different responders, and then there will be facilitator everywhere in the initial one. So Dr. Abhijit, can you have you seen that transcript? Okay. So, okay, this was for one person. This I'll show later. So should we start with the concept of coding?